My name's James. So originally I started off with a Bachelor of IT and Business Information Systems, which was the worst decision of my life. I hated the year and a half I did of it. So I went on a holiday, came back and thought that I'd give something else a go and chose nursing. I had some friends that had already started nursing at uni and they sort of got me into it, and then I realised just how different nursing is. Every day is different. A morning shift, afternoon, night shift, nothing is ever the same. So at the moment I work in the State Burns Unit at the Alfred Hospital in Prahran. It's a very good question. A lot of people think that we just wash patients and that we still wear, the hat and the cape. We don't. A lot of my day is spent counselling patients, talking to family, doing big wound dressings for big burns, putting drips in people's arms, giving the dreaded injections, lots of medications in all different forms. So my day is always different. It's very busy. You do. Having said that, I did faint in the first time I went into the hospital and went into theatre. But look at me, 2 years on now, and I've gotten used to it. Everyone has their own little tricks as to how they learn to deal with the gory side of things. Everyone can be suited. Everyone can learn to love it and to bring their own things to it. When I speak to friends who are nurses outside of work, we all go off and do, some go car racing, some go and play golf. Everyone's got different interests and backgrounds, and we all seem to come together and work very effectively. I enjoy, it's probably very cliched, but I enjoy being able to help people. It's a profession where you can take really unwell people and see them all the way through the good times and the bad times, be there to hold their hand when they're upset and in pain, and then see them walk out the door with their family, 2 months, 6 months, 12 months, however long it takes. It's great to be able to see that progression, that health that you've been able to give back to someone. So there's lots of opportunity. Gone are the days where we're all by the bedside doing the supposed washes. These days there's nurse researchers looking into preventative health, there's nurse immunisers, there's nurses in theatre, there's emergency nurses. In my unit where I work, there's nurses who would go out to site. If there's a major state incident that requires burns nurses, we would actually go out to the site. So there's nurses working in all areas of healthcare now. Every day, lots of variety and lots of different jobs. And nursing is something where you can always add on. You can do your basic registration and then you can add on, your immunisation or your theatre qualifications. There's always somewhere that you can move with nursing. There's lots of travel. With the new state board, we're allowed to travel all through Australia. We're registered as one country now. So I had friends who went over and helped out, with the Queensland floods. So they were able to go up there and help out with the hospitals up there. So there's lots of national opportunities and international as well. There is a worldwide shortage for nurses. So you can take travel holidays and go overseas and work and take a holiday in, Fiji is where some of my friends have been to. So there's always somewhere you can take your nursing career. I would say give it a go because, like I said, people come from all walks of life and you don't know if it's going to be for you until you start and you give it a go. It's like everything, you've got to give it a go to see whether it's going to be for you. So I did not absolutely love it. I have not turned back. Choose science subjects, choose like psychology and biology and start to develop an understanding of what nursing involves. Go to the nursing expos, ring up the hospitals and speak to their intake coordinators, and they're happy to show you around and do tours of the hospital. Get yourself in there and see what a hospital's like and talk to nurses. Find out, go to your GP and ask your practice nurse. There's a nurse somewhere that you can talk to about taking on a career. Do what your heart tells you that you should be doing. If you want to follow something and it's going to be your career for the next 30, 40, 50 years, do what you're going to enjoy, regardless of the money. Do what suits you. The best advice I've ever received is to keep trying. To don't give up and to keep trying, because it took me a couple of goes to get into nursing. I didn't do very well in my business degree. Obviously, I hated it. So it took me a couple of tries with different universities, different interview processes to get in. I was ready to give up, and then I sent one last application off and it came back that I was accepted. So keep trying and do not give up. One of the probably most exciting and rewarding things that I've seen is we had a very long-term burns patient. He was severely burned, so 70% of his body was covered in burns and needed skin grafting and lots of surgeries. And I went on a holiday and came back, and I happened to be walking down the street and did a double take, and there was this patient that I'd been looking after, and he just looked incredible. He'd regained movement in both of his arms, he was walking down the street with his family, his hair was starting to grow back. It was just great to see him with his family outside of the hospital, to see the difference that you can make in someone's life. That was just incredible. Every day, you don't always get a thank you from someone because they're tired and they're sick, and they don't want to be in hospital. No one wants to be in hospital, but a lot of the time it's their family members saying, thanks for helping mum out, or thanks for looking after dad. You guys have done really well. It's seeing them walk out of there or wheelchair out of there. It's good to be able to see the difference that you've made. I think that any student that is thinking about choosing a career in health should go for it and realise that they're not limited. I know lots of nurses who work as paramedics. I know lots of nurses that have gone on to become physiotherapists. I know dietitians who have become nurses. I know doctors who work as nurses as well, and vice versa, nurses that work as doctors. So you're not limited. Once you've got the foundation of nursing, you can take that anywhere. Everyone wants someone that's got some sort of health knowledge or health background, and nursing just covers the whole lot.